Alright, so we're doing an ankle eval. First, you want to start with the history. So ask them where their pain's at, what happened, when did it happen, have they done anything for it, have they done it before. Um, Ask them if they've taken anything for it. Also, ask how bad the pain is, rate from like 1 to 10. 10 being so bad that you think you need to go to the hospital. Ask them if it was an acute onset or if it's been going on for a while. I think that's about it. Okay, so then you want to get into the observation. So look bilaterally to check for swelling or deformities, any kind of bruising or ecchymosis. And yeah. And then palpations, bony and soft tissue. So you want to do the lateral medial malleoli. And then you want to get into where your perineals are, the groove, your navicular, all of your tarsal bones. Awesome. Okay, like calcaneus, the insertion of the plantar fascia, follow the plantar fascia up to the metatarsals. Feel the metatarsals. Sesamoid bones. And then extensor digitorum brevis, tibialis anterior, your Achilles tendon, into your gastroc and your soleus, and then your tibia, and also you want to feel the fibula. Beautiful.
Your pure shock doesn't matter.
Oh, no, it'll still go. It's not a big deal. Okay. Yeah, that's about it. Okay, so then you want to get into manual muscle testing. So first you want to have them do active, so dorsiflex, perfect, and then do it bilaterally. Perfect, okay, then plantar flex, perfect, inversion, eversion, and then do some,
Rotation.
Yeah. Medial and lateral rotation. Okay, and then I'm going to do passive, so push it into dorsiflexion, and then do the same thing over here, and then plantar flexion, plantar flexion, then inversion, inversion, eversion, eversion. What was I say? Oh yeah, and then medial lateral rotation, medial lateral rotation. Okay, and then you want to do resistive, so pull up against me. Awesome. Push down, push in, push out. Perfect. Okay, and then you would want to do it bilaterally too. So pull up, push down, in, and out, and perfect. Okay. And then have them do passive great toe extension and flexion. And then if there's no pain with that, do resistive, pull up and then push down. And then you can also do the toes. So extend your toes. Perfect. Flex and extend. Woohoo. No pain with that. And then do resistive. It's so yeah, that's weird. Perfect. Okay. And then you want to get into special tests. So start out with, we'll do the talar tilt. So you just take the foot and you rotate it in, recreate the mechanism of injury, moving the talus. And then you would want to check the other side just to check laxity. And then you can do Kleiger's, which is passive dorsiflexion and eversion. It is indicative of a high ankle sprain, syndesmotic sprain. Also, you can do the squeeze test, which you just compress the tibia and the fibula. It is also for a high ankle sprain or a fracture of the tibia or the fibula. And then you can do an anterior drawer, which is, jeez, beats. Okay, there we go. Just translation of the talus and the calcaneus, and it tests the anterior talofibular ligament. And then flip over on your stomach. Don't fall this time. Okay, and then you have the Thompson test, where you squeeze at the gastroc, and then if it plantar flexes, it's just for Achilles tendon rupture. So if it doesn't do that, then you ruptured your Achilles. Okay, you're good. Oh yeah. And then another one for a fracture would be the bump test, where you just heel strike, and then if it sends shooting pain up to that one particular spot, then that means that you fractured something. And then you would come to a clinical decision. And we're done.
So
Hooray!
excited about that.